Good evening, and welcome to another edition of Wellness Watch right here on blackdoctor.org. We're also on the Black Doctor Speak Facebook page, and so we're excited this evening again to talk to you and bring to you issues that are imperative and that are important to our community and to our ethnic group. And so tonight, of course, we have a lot of great information for you, but we also want to make sure that you are putting in the comments, let us know where you're watching from, because we like to see where you're watching us from all over the nation, all over the world. So drop that in the comment section. We also, if you hear some information that you know that you like, or that you know that somebody could use, please make sure that you are putting it and that you are tagging your friends and that you're sharing it on your page. So we'd like for you to share this information with your friends and family. We have a really, really exciting show for you tonight. Tonight is all about Black women and Black women's health. And so we are excited to really dive into this topic. We've got some wonderful, wonderful speakers, panelists that are going to come on from the Black Women's Health Imperative. So I'm going to shut up and get to the man of the hour, the man that you are all here to see, and that is Dr. Michael Lenoir. How are you doing, Dr. Lenoir?
I'm doing really good tonight because I'm so happy to have as partners the Black Women's Health Imperative. They've done a great deal of work in a number of very relevant areas that we at the African American Wellness Project are emphasizing and focusing on. Certainly maternal health is important, COVID is important. A lot of things are important, and we share, I think, some of the same goals and objectives. The African American Wellness Project, as you know, is 20 years old, and we have been doing some of the same work. So, but first, before we get started on the important discussions that we have to have with our guest, I'd like to know a little bit more, and I think our audience would like to know a little bit more about the Black Women's Health Imperative. And Ellis, can you introduce our guest who's going to discuss that with us for a few minutes, and then we'll move into more meaningful, substantive discussions.
Yeah, our first guest is Dr. Kenika Harris, and I'm going to bring her on screen here. And this, she has a PhD and an MPH, so she's got a whole lot of alphabet soup after her name. But ultimately, Dr. Harris currently works as a director of maternal health for the Black Women's Health Imperative. She is a behavioral health scientist with a special focus on health equity, maternal health, and women's health. She's also serves as a maternal health equity advisor for the state of Maryland and the public health expert for the Lactation Commission in Washington, D.C. Dr. Harris is also co-directing and producing a documentary called Listen to Me, which people need to listen more than they speak nowadays. So I'm with you on that one. Listen to Me, which explores 4 women at the front lines of the Black maternal health movement, walking the tightrope of racism and birth in America. And I'm going to say this on a personal note. As a Black man and as a father of 2, I think is very important. I think that is America's dirty little secret in terms of the amount of the maternal health, and those statistics about Black women and maternal health are horrifying. So I want to applaud you ahead of time, give your flowers ahead of time for taking on this project. So welcome to the program tonight, Dr. Harris.
Yeah, how many Dr. Harrises are there? I mean, with all of the things that you have in your resume and all the things that you do on a daily basis, I think there must be at least more than one.
Dr. Yes, Harris. I think so.
So tell us a little bit about the Black Women's Health Imperative, what it is, why it was formed, who composes it, and what are some of your main goals and objectives?
Absolutely. So the Black Women's Health Imperative, we have over 38 years now of really fighting for the health equity of Black women. And it was started on Spelman's campus with the amazing Billy Avery, who really was fighting for reproductive justice, getting us to understand reproductive justice. And, we just focus on the total health and wellness of Black women, financial, physical, emotional, all of those things that we know, mental, all the things that we know that we need to be healthy. We have an array of programs in reproductive justice. We focus a lot on the policy piece. We have programs in terms of diabetes and chronic disease and wellness. And so we really focus nationally on everything Black women, supporting all the health needs of Black women. And we have a new initiative around anti-racism as well.
So that's a lot of very, very important objectives, and you seem to do it very well. And so we thank you for just the opportunity to partner with you and to have you as our guest today. Usually we start our program, Mr. Dean and I, talking about the COVID epidemic. We have limited knowledge, and we're glad now to have an associate with us tonight, Dr. Latonia Washington. She is the president of the Bluff City Medical Society, and I believe Dr. Washington, is she on the phone? Is she on the? I believe Dr. Washington, weren't you the NMA's chapter of the year when we in Oakland weren't the chapter of the year?
Absolutely, we were NMA chapter of the year in Memphis at the Bluff City Medical Society.
Oh yeah, we had to give that.
I think Dr. Lenoir is feeling a little some kind of way about that. He said his feelings a little bit about that. It's okay, Dr. Stop the color one time.
Plus, it was virtual. We couldn't go to the stage. So, obviously, no, but Bluff City is a very famous and a very important member of the National Medical Association, always has been, and we're proud to have its president to talk about the COVID virus. We've talked about it a number of different times, but I still think there's a couple of questions that we have left unanswered and on the table. First of all, why do you think this virus disproportionately impacted African Americans?
That is really a multifaceted question when we talk about why COVID really disproportionately affects Black and Brown people. When we talk about that, we have to think about just how we live. Many people who live in multi-generational households where they have, grandparents, parents, kids, and grandkids all in the same home. So that is one way that the virus can spread if you're living in close quarters and don't have the ability to social distance. We also have to think about the number of Black and Brown folks who are in really forward-facing essential workforce. We heard at the beginning of this pandemic that as physicians, we were the essential workers, and I argue against that. I mean, yeah, we are essential, but really the people who work at our grocery stores, the people who work in at the post office, delivering our packages, the truckers who are bringing in food from manufacturers, they are really the ones who are the essential workers. And we realized that very early on during this pandemic. We all experienced those food shortages and things like that. And so in those instances, you may have to work in close quarters in factories where you don't have the ability to social distance. And we know that in enclosed spaces, those viruses can spread. And when you have a lot of contact with others, the virus can spread. So that's really the main reason why COVID is disproportionately affecting Black and Brown people.
Yeah, we call them the early bus responders. They didn't even know the virus was out there, and they were on the front lines. Whenever they talk about first responders, they usually mention the doctors and the nurses, and they do deserve a lot of credit. But they forget about the early bus responders, the ones that really took the heat, and for a number of reasons why we got into the problems that we had. A couple of other questions that always keep coming up is that many people are hesitant to get a vaccine because they feel that they can handle a coronavirus infection. Now, you and I both know that the coronavirus infection really is maybe not that bad. But what about some of the residuals?
I have said really since the beginning of this pandemic, I was more afraid of COVID-19 than I was of the vaccine. And so that was really a large part of the reason why I got vaccinated, and I encourage my entire family to get vaccinated against this disease. One of the things that we don't really have a good understanding about with COVID is why some people have severe symptoms and some people don't have severe symptoms. I've seen in my hospital 80-year-old grandmothers who had a lot of medical problems who were completely asymptomatic when they had COVID-19. And as a converse, I've seen a healthy 28-year-old who was very sick and had to be in the ICU and on the ventilator for because of COVID-19. And then I've also seen the reverse. So it's really hard for us to know who will have severe disease and who won't. Of course, we have studies that show that people that have pre-existing conditions or chronic conditions like obesity, lung disease, diabetes, high blood pressure are more likely to have severe effects from COVID-19. But again, it really is kind of up in the air. I've really seen it across the board. And so I think it's really important that we protect ourselves. We do talk about residual. I'm going to be on a webinar tomorrow night through the Bluff City Medical Society where we will be talking to a COVID survivor. And this is a gentleman who was in his mid-50s, developed COVID-19 and was in the hospital in the ICU for 2 months, on the ventilator for about a month and a half. He got over COVID, got out of the hospital after that time, and then developed a severe infection because his immune system was so suppressed from COVID that the bacteria was able to attack his heart valve and cause him to have heart disease. He had to have open heart surgery. So, that's just one of the things that we talk about with the residual effects of COVID. COVID also affects the kidneys very severely. We have a lot of patients who are post-COVID who have to be on dialysis. Really for long term. It really caused their kidneys to shut down. They have some long-standing heart disease and some chronic lung disease. So all of those things, those are side effects that I don't want. If I can prevent it, then I don't want that. And I don't want that for anyone that I know or any patients that I care for.
Yeah, so people need to appreciate the go ahead, Ellis.
No, you're making an interesting point, and I think that we talked about this last night. We did a program on COVID last night for California, and I've been reading some of the latest research, and they're talking about COVID being more of a vascular disease than a respiratory disease, as we initially thought. And I'm saying we in terms of people that work loosely and around medical health and wellness. And so when you're talking about vascular diseases, that's more pervasive because that attacks the heart. It can attack multiple areas in the body because it's getting through the blood vessels and the blood system. And so we haven't talked, and I don't believe, and I'm saying we in a general sense haven't talked enough about the long-term effect of COVID, whereas we've kind of been focusing so much on the vaccines and people have been focusing on long-term effects of the vaccine, but they're not talking about the long-term effects of even if you survive from COVID, now you have a pre-existing condition for the rest of your life that could be impacting your health for the next 20 or 30 years. So yes, you might survive it, but you're going to have health conditions. You could have health conditions that could be severe. And I think we need to talk more about that and less about, how the vaccine could, impact your life.
Absolutely. And so really kind of to piggyback off of that, one of the things that I will say, and I think that for the most part, this is somewhat anecdotal, but what we've seen is that some patients who have what we call long haul COVID, meaning that they have the long-term effects from COVID. So that's what that word means for all the viewers. Sometimes they have said that after they received their vaccines, that they actually improved. So again, I think there are additional studies that are going on about that. But also when we talk about COVID being a vascular disease, understand that blood vessels go throughout our body. They supply all of our organs, everything. And so if COVID can affect that, and when we talk about the long-term disease, understand that, yeah, you may survive COVID, but you may not be able to work. You may not be able to provide for your family. If you're a very young person and you haven't chosen to purchase life insurance or disability insurance yet, all of these conditions that you develop from COVID will be pre-existing. So that will exclude you from being able to do that. So those are all things that you have to consider as well when we talk about COVID and COVID prevention.
Our special guest today is Dr. Latonia Washington. She's the president of the Bluff City Medical Society, an organization of the National Medical Association. We're talking about COVID, and we're going back over some of the important points that you need to understand. We still have a lot of people and certainly a lot of African Americans who are not opting for the vaccine. I think too often, Dr. Washington, they don't connect what they're doing with the overall success of the vaccination program. Talk a little bit about that. Talk about the variants.
Absolutely. So we know that viruses, the longer that they are out in the community, they mutate. And so when those viruses mutate, that's when we have variants. That's why they're calling them variants. But kind of a term that we will understand is it's a COVID-19 mutant. So really what the push was initially, and really still is the push, but the push is to get us to herd immunity. So that's that 60 to 70% of the US population vaccinated against COVID before the virus mutates to the point that the vaccine doesn't work anymore.
Right.
And so really that's what we're saying, and that's why we're really pushing for vaccination. And then when we talk about herd immunity, right now we're really at about, I believe the number was about 46% of the US population that was vaccinated against COVID-19. We need to be at 70 to 80%. So
Right.
really at the rate we're going, we're not going to get there, particularly when we hear that now states are opening up. They're easing the mask mandates. I know here in Tennessee, the mask mandate was lifted last week. We have people who are attempting to walk around in the hospital without masks. Of course, we are shutting that down, but it's important to understand that we have COVID all around us. And so if we aren't able to protect ourselves from getting COVID-19, and by being vaccinated before the virus mutates and such that the vaccine won't be effective, then we're going to be dealing with this pandemic for probably at least a couple more years. And so I know we've given up so much already for the past 18 months. Can you really see us being still in this state next year this time or the year after this time? And that's really what we're looking at. And so, that's why we're encouraging vaccine use.
Well, I'm looking at what happens in India, and I can watch variants develop just looking at the television. We're in a worldwide struggle against this vaccine. There's no reason why we can't do the best we can do at home. Talk a little bit of now, this week or last week, they announced that the vaccine is now available for children down to 12. I fully expect that in the next 6 to 8 months, it'll be children down to 2. A lot of parents have questions. If children don't have such severe disease, why is it important that they be vaccinated?
So, yeah, that's a really great question. And so when we talk about children and COVID-19, it is true that most children don't have severe COVID disease. However, there is kind of a post-infectious syndrome that children can get that's called MIS-C, which is the multi-system inflammatory syndrome of children. Those kids can be very sick. They have severe long-term effects. And a lot of people who develop that will end up dying. Of course, we don't want any kids to die. So that's why we want to prevent that. Also, we understand that although kids do not have severe COVID disease, they can spread it readily. So think about kids going to school. I say that children really have been the most protected during this entire pandemic because what happened in March 2020? The schools shut down, and they really have been shut down since then. So we haven't had large groupings of children together. Well, we know that going into this upcoming school year that the schools are likely going to be open. And so you have that as a place where children not having severe disease, they could be spreading COVID to their teachers, to their parents, to everyone else in the community. But also when COVID is in a high percentage in a concentrated area, that also causes more mutations, which we don't want. And so that is really the impetus to get kids vaccinated against COVID. So I'm really looking forward to the vaccine age being lowered down to 2. I know a lot of my colleagues who have kids that are in the 12 to 16 age range. They have been going to get their kids vaccinated. And I really do think it's a positive thing. And I think it's very important. Also, a number of colleges and universities have instituted vaccination requirements for their students to return to campus. And I think that's a positive thing as well, because when we have COVID concentrated on a college campus, kids in college don't necessarily have the ability to do the social distance, to quarantine. They don't have that necessarily that medical oversight to make sure that they are receiving the care that they need. And some young people can really have severe disease.
You know, I'd like to milk. You're one of the best guests we've had to talk about this issue. I have some questions, but so does our audience. They're asking, will the children's experience the same side effects from the vaccine as adults?
Right. So traditionally, children have fewer side effects from vaccines than adults, but the side effects from the COVID vaccine were really relatively mild. You know, you may have a low grade fever, you may feel a little bit achy or feel a little bit sluggish. I know that was my experience with the COVID vaccine, and it lasted 1 to 2 days. I took some Tylenol or some ibuprofen, and those symptoms went away. It was very short lived. Now, my mother, on the other hand, who is in her late 60s, received the vaccine and she had no symptoms, especially after her second dose. I thought she was going to be feeling under the weather and she was completely fine. So it really varies per person, but it is my thought that children will likely have less severe side effects from the vaccine. And I don't believe that the side effects should really hinder you from receiving the COVID vaccine at all, or the fear of side effects should hinder you from receiving the vaccine.
You know, when I was growing up, Dr. Washington, there was a character in on TV called the Lone Ranger, and the Lone Ranger wore a mask all the time. Now, I have the same philosophy about my mask as the Lone Ranger. I don't care what the CDC says. I don't care what they say for the state of California. I'm keeping that mask on for quite some time. Talk about talk a bit about the directions from the CDC. What do they mean? And what do they mean to you?
Yeah, well, first of all, I will say that I agree with you with the mask wearing. I haven't had an upper respiratory infection in over a year. We had essentially no flu cases in our hospital this year, so that is telling me all I need to know about wearing a mask. It certainly does prevent disease. So we heard this week about the CDC saying that vaccinated individuals can be indoors without masks. And, you know, I think that if individuals are vaccinated, then that is okay. But there is no way for us to know if everyone is, in fact, vaccinated when you go to these public areas. We know that there's been so much controversy around this COVID-19 virus. There are a lot of people who still don't believe that COVID is real. There are a lot of people who won't get vaccinated, but they may still go maskless. And so that is a major concern because, again, we haven't reached that herd immunity point, and COVID is still spreading throughout our community. I was on a call today with our hospital administrators that told us that our COVID cases are up about 20% and our COVID hospitalizations are up and our number of ventilators used are up as well. And so we're able to see that. And so my concern is that, you know, we'll really get to a point where our medical system will be overwhelmed again from COVID-19. And we really shouldn't be in that place, you know, 18 months to 2 years out of this infection. Like, we know how to manage this with prevention. So I'll be continuing to wear my mask because I don't trust other people.
Yeah, you don't have to worry about me. When you see me, I'll be masked up. I may pull my mask down so you know who I am, but that
Right.
may be about the only time I change. Finally, really quickly, in the time that we have left for this segment, tell us a little bit about pregnancy. What happens with pregnancy and the coronavirus?
Okay, well, I will certainly start by stating my disclaimer. I am not an OBGYN. However, what I do know about COVID-19 and pregnancy, and I've talked to a lot of my colleagues, and they often get internal medicine consultations for pregnant patients who have COVID-19 and have severe disease. You know, pregnant women tend to be more severely affected by COVID. If you think about, you know, pregnancy as the baby is growing inside, you require more oxygen. And so with the virus affecting the lungs, you may feel short of breath more easily. Some pregnant women feel short of breath at baseline. And so then you have COVID on top of that. And then when we talk about the vasculitis, you know, certainly there is risk for long-term effects from COVID-19. Some of my OB colleagues have shared with me that they've had patients that had severe COVID and had to be on the ventilator, and they had to do emergency C-sections in the ICU to get the baby out because the infant was under distress. And so certainly we don't want that to be the case for any expectant mother. The vaccine is approved for pregnancy as well, really in all trimesters. The ACOG, the American College of Obstetrics and Gynecology, does recommend and support COVID vaccination for pregnant women. And it is also thought that once they receive the vaccine, that they are able to pass on some of those antibodies, some of those protective antibodies once they give birth to the baby. So it's really kind of a win-win in that the mom is protected from severe disease, but then also the baby is protected as well.
And well, thank you so much for taking the time to talk with us about this. We have a number of questions that I may have to get offline, but I think we need to move to some of them as important part of our discussion, and that's the issue on maternal health. I think we at the African American Wellness Project have been so very concerned about the increased mortality rates for African American women. The statistic that sounds that Mr. Dean and I have talked about maybe 15 or 20 times is that a Black woman with a PhD has an increased, a greater chance of dying in pregnancy than a Caucasian woman with a high school degree. And that's kind of where we start. So, Mr. Dean, could you introduce our next guest who's going to talk to us about this particular problem?
So once again, I'd like to welcome back Dr. Kanika Harris. She is a PhD and she is part of the Black Women's Health Imperative. And she, when we introduced her earlier, we were talking about her role in terms of bringing more awareness to the Black maternal health situation that is really out of sorts with what's happening in terms of general population. And we're talking about awareness and action. And so I think that action piece is the most important piece of it. Yes, we got to get more people aware of what's happening in terms of the mortality rate, in terms of Black maternal health. And then also we have to say, okay, now that we know about it, what are we going to do about it? And so Dr. Harris is on the forefront in terms of making sure that we are both aware and we are acting upon so we can lower those numbers in terms of the mortality rate of Black maternal health. So thank you again and welcome again, Dr.
Dr. Harris, first of all, $64,000 question. Why? Why are Black women dying at so much higher rates than other women?
Yes. So that first statistic you just mentioned, that's me. When I was getting my PhD, I was carrying twins and I suffered from preeclampsia, and the mistreatment that I experienced in the hospital caused me to almost lose my life. I spent 3 days in ICU and I lost my twins. So I am that statistic. And that did happen to me 10 years ago. And so I look at myself and ask, why? Why did this happen to me? Why is this happening to Black women? And it's a two-pronged answer. One, we know that just living in America, Black women living in America, we have a history since we've gotten this country of our boundaries and just our lives being encroached on by racism and really affected by racism. Racism meaning a system that really supports white lives over Black lives in a lot of different ways, politically, educationally, healthcare wise. And so when you look at what's happening to us, it's the stress over our life course and when I say life course, I mean from the time we are born, that really is a cumulative effect on our bodies that make us more high risk when we become pregnant. And that stress and that racism can look from, so for me being a PhD, it can look from being in all white environments, trying to prove myself, knowing that as a Black woman, people don't look at me as a credible source of information for anything, let alone if I'm telling you I'm in pain. So all of those things across our life course, how we fight, how we are fighting for our family, how these barriers are against us, cause stress. And we know that over time, studies have shown that that stress, which is called the allostatic load, how we balance that stress, how we balance those stress hormones in our bodies can affect our reproductive abilities, and can cause poor pregnancy and birth outcomes. And the other part of it is how we're treated in the healthcare system. You know, in my situation, I was bleeding out when I entered the emergency room, and they asked me for my insurance card first. You should have done that later. You missed vital time to save me and my babies, because you were asking me for my insurance card. You know, Dr. Washington was talking about COVID, and we're talking about these twin pandemics of racism and COVID right now. And we have the perfect example of that twin pandemic with Dr. Susan Moore, who was a physician who died in the hospital when her pain and her COVID symptoms weren't treated accurately. And if a physician can't advocate for their own selves, then how are we supposed to advocate for ourselves? So I'll stop there.
No, I think first of all, I do want to say, Dr. Harris, we empathize with what you had to go through, and so I don't want to just treat that lightly, because that is a significant point in your life, and I appreciate the fact that you took that pain and you're trying to help other women from experiencing that same distress. So I just want to make sure that we give that the proper justice that it deserves.
Thank you.
Yeah, and you know that we in the African American Wellness Project were founded on just this issue. We believe that healthcare that is poor in quality for Black people starts from the bottom up, not from the top down. Is that the top down situation has not helped us as Black people. And so our primary objective, and I'm not going to spend much time with that, is to, at the African American Wellness Project, is to give Black people the tools to go into the system, to have an advocate, to navigate, to demand the kind of health care that is responsible that for some of the things that we're seeing. But is this a genetic problem? Or is this something that has to do with unconscious bias or something about the system? A lot of people say, well, maybe this is genetic. Maybe Black people are not built to have children at the same rate. I've heard that discussion. What do you think?
We're both chuckling because I guess that's so far from what.
Yeah. I mean, yeah.
I've been listening in the doctor's lounge for a long time. I've heard a lot worse things than that.
Yeah.
But what do you think? What part do you think the system plays? And is this a genetic problem?
So first of all, we have the science to prove that it's not a genetic problem. Neonatologists Richard David and James Collins in 2007 came out with a study to show, if you want to prove that it's a genetic problem, let's look at African-born, mothers, because we are all of African descent. So let's look at African-born mothers. So mothers that were born in Africa that birthed in the U.S. had the same birth rates as white women, but their children started to have the same birth rates as Black U.S. born women, right? So you're seeing within one generation that their children that were born in America start to have the same birth outcomes as Black Americans, but their mothers who were born on the continent of Africa had the same birth outcomes as white women. So we know that if it was genetic, then Africans would be having these same birth outcomes in the US as US born Black women. And so that really shows us that there's something about living in America and the stress of living in America that has caused these high-risk issues for Black women. And we've done studies controlling, and by what I mean controlling, making sure that we are accounting for all different things such as pre-existing conditions, nutrition, doctor's appointments, all kinds of variables that we are known to say predict poor birth outcomes for Black women or low birth weight situations. And after controlling for a numerous amount of factors, we see that Black women have reproductive outcome, and their stress levels are equivalent to white women. So a Black woman in their 20s can have the stress levels of white women in their 30s, right? So there's something about that stress that we're seeing that affects our birth outcomes, and the stress of just going to doctor's appointments. And we know that when we go to a doctor's appointment, we have to perform, right? When you ask us questions like, how many babies have we had? How many abortions have we had? You know, we know that depending on what answer we give you, you're already coming up with stereotypes about what kind of person we are and if we deserve proper care.
Yeah, I think, you know, ultimately, and so I'm going to ask the simple question: what can we do? Right? Is it do we? And I hear Dr. Lenoir saying about, okay, we've got to work from the bottom up. So if the bottom up is, does that mean that we need to explore alternative methods of childbirthing? Right? Do we need to have Black women kind of remove themselves from the medical, you know, system altogether and work with midwives and doulas and everything else, and have more children at home, where you have a better chance of having somebody that's going to be considerate of you and your birth needs? Or do we continue to fight the system and get the system to try to change and be more empathetic to Black women and their causes?
Yeah.
Before you answer that question, let me combine that with a question that we want to ask about doulas. Mm-hmm. And you can tell us exactly what those are as it kind of integrates into your answer for Mr. Dean.
Absolutely. So we've seen for Black women definitely an uptick in home births and birth centers during the pandemic. Just being afraid of not having advocacy and maybe only having one person in the room. At the beginning of the pandemic, it was nobody you could have advocating for you in the room in terms of birth. And also, yeah, it's a both and. Because say, for example, someone like me, being pregnant with twins, and just to talk about that whole thing about Black people and pregnancy. I've been pregnant with twins twice. And, you know, my second pregnancy was successful. And so I just say that to say that having multiple births, that takes you out of a birth center in a home birth situation, right? Okay. Black women are birthing later. And sometimes the risk that you may come into when you're pregnant, you may just be more high risk in terms of you may have some pre-existing conditions that you didn't know about walking in, right? And that X's you out of the birth space and the birth center space and the home birth space, just for liability issues. So that means that, and a lot of us will fall into that category. So what that means is that it's a both and. Yes, absolutely. We need to put more resources in the birth centers and home births for women to have those choices. The most important thing about having a successful birth is feeling safe, you know? Right. And so if you're going to feel safe and supported and get the care that you need at home or in a birth center, by all means, you can do that. But for those of us who don't check those boxes to have that birth, we need to know that the hospital is also going to be a safe space for us, and we can have successful births. Doulas are just, you know, I became a doula in 2006 when people were like, a doula, what's that? Now I feel like everyone has at least heard the word. A doula is a support person that provides non-clinical support, informational support, physical support. In this case, we're talking about for women during birth. There are all kinds of doulas. There are death doulas. There are postpartum doulas for after you get home with your baby and you need care for your baby at home, which is equally as important, especially when we're talking about postpartum depression and maternal mental health for Black women. And I would just say this month is Maternal Mental Health Month. And so Black women's health imperative is focused on maternal mental health for Black women, because when we're experiencing these traumas in birth, we are also more likely to experience postpartum depression. And so doulas can advocate for us to have the birth that we want, and we know that we need. And then for postpartum doulas, it's important because when we get home, we may need that support, or we may have things that are happening to us that need follow-up medical attention. So for Black women, we're looking at over 30% of deaths happening postpartum. Remember, maternal mortality is a death that can happen within that first year of delivering a baby. It's not just giving birth. And so we need that wraparound care for at least the first year. Yeah.
So recently we had an OBGYN come on, and they talked about, we were talking about this subject, and they talked about having groups of Black women coming together and almost like
So like centers, I think is.
Yeah, it was like a support group. They were in the same in the same trimester of their birth, so they were and they met, whether it was online, virtually, and they found that the outcomes were better because they had somebody that they could bounce if they're pregnant alone. They've got a group that they can lean into, and they could reduce some of the stress levels, and that found to have better birthing outcomes. So do you think that model should be kind of spread out across the country? Is that feasible? Is that something that could be done in especially in our major cities across the country, where we've got groups of Black women in these kind of group settings where they can express themselves, talk about how they're feeling, kind of talk about their birthing experience, and that helps reduce their stress because they've got an outlet for their emotions?
Yeah, I mean, absolutely. Black women, traditionally just human beings, we don't birth alone. We don't birth in silos. We don't birth in isolation. And somehow we've built up this idea of the American dream that you have this dyad with this husband, and you go to a hospital and you have your baby and you guys figure it out. And that's not what it is. Tribes of women come together to feed you, to make sure you get sleep. The most important thing in having a new baby, being able to have your body produce food for this baby, sleep and nutrients. And you need time off for that. You need someone to take that baby while you go to sleep. You need other women that understand what's happening to you. And I definitely, we do have peer support groups for pregnancy and for lactation. And that's been just really, really successful. And I will also point to Shalon's map. Shalon Irving was a colleague of mine that passed away of postpartum complications, and her mom, Wanda Irving, has continued her legacy with her friends, and they've started the organization Shalon's Map. Shalon's Map has an app out, so look up the Shalon's Map app, because it provides a space to build community for exactly what you're talking about, Ellis, in terms of peer support. So if you can't get together, COVID is still an issue, you can create these groups of support on that app.
Amen. Let's before you go, Doc, I want to bring in Kenika Shealy. She is the policy counsel at the Black Women's Health Imperative. So that means she's an attorney. Okay, and that means we got to be careful with what we say, because when attorneys get around, you got to make sure you say the right thing. But she's a skillful attorney with extensive healthcare, corporate, and advocacy experience. Through advocacy, policy, and strategy development, she assists and serves to improve the health and well-being of the nation's Black women and girls. Prior to joining the Black Women's Health Imperative, she began her career in the pharmaceutical industry and worked for corporations including Pfizer, Eli Lilly, and Novartis. There, she continued to pursue her passion for medicine and the services, and was an ally to patients and physicians in treating a variety of diseases. Welcome.
Thank you for having me.
You have one of the things that I appreciate most about the Black Women's Health Imperative is that you recognize the need for effective and organized action. And obviously that has turned you into both a policy and a legislative institute. So tell us something about some of the laws that have been passed in response to this maternal mortality issue, and some of the things you're doing to enhance the implementation of those laws.
Absolutely. And as you know, one of the major pieces of legislation that we're supporting is the Black Maternal Health Monobus Act of 2021. And as you know, you alluded to, there's an alarming maternal health crisis in this country, and it's claiming the lives at a staggering pace. Unsurprisingly, as we've spoken about, the situation is most severe for Black mothers, who are 3 to 4 times more likely to die from complications of pregnancy or childbirth than white women. And this racial disparity persists regardless of age, socioeconomic status, education, or other factors, as you mentioned, Dr. Lenoir. So to address this maternal mortality and racial disparities experienced by Black mothers, Representative Lauren Underwood and Representative Alma Adams and members of the Black Maternal Health Caucus introduced the Black Maternal Health Monobus Act of 2021. And this legislation is really composed of 12 individual bills that will advocate for a 12-month postpartum Medicaid coverage, promote a diverse perinatal workforce, invest in rural maternal health, implicit bias trainings, and other critical policies so that every facet of the Black maternal health crisis is addressed. This year, the Monobus is much more expansive and it includes 3 new titles, including the Maternal Health Pandemic Response Act, the Maternal Vaccination Act, and the Protecting Moms and Babies from Climate Change Act. And these bills will advance policies to address the risks to pregnant people during the COVID-19 pandemic, increase maternal immunization rates, and promote the health of moms and babies through and post the COVID-19 pandemic, and address impacts of climate change on maternal and infant health outcomes, respectively. So really, this is a critical piece of legislation which reflects the times and aims to legislate solutions for the bevy of issues facing Black birthing people. And BWHI, as a part of the Black Maternal Health Caucus Advisory Group, will continue to work closely with this legislation as we try to fulfill our mission to bring health equity to the nation's Black women and girls. So that's something that we're really strive to advocate for as a really piece of important legislation. And in terms of what we're doing at the Black Women's Health Imperative, well, we're doing a number of things. Of course, we support all this legislation in the Monobus Act. It's hard to choose. It's like asking a parent who your favorite child is. But however, we're particularly most interested in advocating for maternal health and climate and the impact of that. So climate change, as a result of climate change and temperatures across the US are increasing, and heat waves are predicted to increase in intensity and frequency. Alongside impacts on pregnancy, heat kills more people than all weather-related deaths combined. So for Black women, pregnancy outcomes are exacerbated by climate change. Undoubtedly, heat exposure plays a detrimental role in one's ability to have a healthy birthing experience. So if I may, I could share a few points about, climate change, its impact on maternal health. One, for instance, is that found that one study turned up preterm birth and exposure to heat found Black and Asian mothers had larger impacts from heat exposure than white mothers. And Black women had more hospitalizations due to heat exposure during their pregnancy than other women. Also, marginalized communities are more likely to reside in urban neighborhoods, referred to as heat islands, and they're significantly warmer than the rural or suburban communities. And that's because the heat is trapped in the concrete in the buildings, and there are fewer trees to provide shade. So BWHI is really invested in advocating and promoting the Protecting Moms and Babies Against Climate Change Act as a part of the Monobus legislation, which really centers the equity and the lived experiences of Black women.
I'm sorry. Go ahead. I want you to finish. I just got a question really about, I fully am behind the legislation, but I'm looking at the makeup of our Congress, right? Mm-hmm. Being predominantly white and male and having, very little, what do you think, what's your feeling in terms of getting that legislation passed when we have a Congress that really can't seem to agree on anything. And when we're talking about legislation that is solely focused on improving the health outcomes of Black women, do you think there's enough people in Congress that actually care? I'm to be as blunt as possible.
Well, I'm hoping so. We have, the good thing is that we have a Democratic administration. We have the House and the Senate, and we have a president and administration that centers equity, and it's a main focus of this administration. So I'm hopeful in terms of this legislation. I don't think, they're passing it as one whole bill, one whole package, but individually. And we have gotten some traction, and some pieces of the legislation are moving forward. So I'm hopeful that all of these issues and all this legislation will be passed in a timely manner. And what we can do as individuals is certainly help the process. That means to contact your legislators, contact your representative, contact your senators, get educated, build the more people that you have to supporting this legislation and getting that word out, the more likely, that's going to pass, and trying to get bipartisan support. So I'm always hopeful that these issues will be addressed.
One of the things that all of us had to do during this pandemic was to kind of make a mojo turn on all of the stuff that we're doing. Discuss a little bit about how you changed your approach during the pandemic, what you did differently, and what are some of the resources you provided to the public.
Absolutely. So, of course, everybody had to turn on a dime with the pandemic. There's no more in-person meetings. So we had to go to Zoom, a lot of webinars, a lot of virtual conversations that really to reach our audiences and to and partner with other organizations to have these conversations and have people that they respected, leaders, congressmen, celebrities, whoever can get the word out and really try to communicate with the public because there's such a dire need right now, especially when there was a time when, access and communication was limited. We're all trying to get our feet under the new situation. So that's the way we had to, change. And we've put out fact sheets about, the legislation, the CARES Act. Most recently, we've put out the Black Women Vote. And in anticipation of the president's election, we developed our Black Women Vote National Health Policy Agenda for 2021. And it's really the cornerstone of our health policies. It focuses on the 4 pillars on access to quality and affordable health care, equitable responses to public health emergencies, sufficient diversity in clinical research, and increased funding to support historically Black colleges and universities. And also we've included a 5th pillar, social justice, which addresses police violence, sexual assault, and incarceration. And under each pillar, the agenda includes a thorough yet non-exhaustive list of the most pressing issues of facing Black women today and policy recommendations to move towards real solutions. It serves to mobilize Black women who we've historically stood at the forefront of the social movements and were instrumental in this, recent election of President Biden to advocate for ourselves and our communities. So it's a blueprint for change and deliver a call for action for policymakers, practitioners, academics, and policy leaders. Also, we have the COVID-19 Surviving and Thriving COVID-19 Pandemic Survival Guide for Black women and their families. So it talks about, again, the disproportionate impact as a resource, patient stories, all from the experience of Black women. So those are a couple of resources that we have. And of course, I always would say, please visit our website, bwhi.org, to find out more information and other initiatives that we're doing as well.
I'd like to bring back Dr. Harris. We're getting close to the end of our time. I want to make sure that we're providing all this great information. That's the most important thing. But we also like to give some people some instruction. And that part of that instruction is, what can people do? Like, what's the number one goal? Is it to vote in their state legislation, or is it talking about focus on our national election in terms of making sure that we're putting the power of our voting, the power of what we can do, of our voice behind the right people that can get these types of legislations passed so Black women can lower that mortality rate when we're talking about birthing?
So yes, first of all, I always want to start with telling Black women, you can sleep if you need to, because we're in a pandemic and we fight all of our lives, right? So like you can take a break, you can take a nap, you can first take the time to restore your health and wellness and rest and take care of yourself. So I just always like to start with that because I have to remind myself, as Dr. Lenoir was saying, in terms of there must be five of you. And I'm like, yeah, sometimes that's what it feels like. So I just want to start with that. And secondly, yes, try and get familiar with, your congressperson, with policies and the way they work. It can be as simple as, Googling the issue you want and what congressperson is responsible for that, and, how to advocate and call. They have templates and letters and toolkits that you can simply just, sign on to and send off to your congressperson. And then, just really think about how you can, what skills that you have to support your community. And a lot of the things that we need to do, we're already doing in some shape or form. We're already kind of, mobile. We've always had creative ways of supporting each other and taking care of each other. So I just want to remind us that we are inherently resilient, and we've been the forefront of making change and supporting our families. And I don't know, Kenika, if you want to add on in any way.
Yes, absolutely. I agree with all of what you're saying. And Mr. Ellis, yes, change starts, policy drives change. So whether we're talking about COVID or maternal health, it is important to get involved at every level, community, state, and nationally. Make the difference, get involved, contact, and hold your legislators accountable for their actions so we can affect change. So,
and I would say from the hospital perspective, I just want to chime in, because a lot of times when we give birth at hospitals or have visits at hospitals, we don't fill out that little survey about how our experience and treatment was. It's so important to do that. We're trying to get out the hospital, we're trying to move on, and then that little survey comes to your phone, or you get a phone call from the hospital asking how your experience it was, and you're trying to shoo them off and you don't take them seriously. That is where our accountability lies in making change. When those patient performance measures comes back, it affects, hospitals in their pockets. So we want to make sure that we do that.
I think that we have gotten our introduction only to the Black Women's Health Imperative. And we have a partnership that will go on for quite some time. You've given us as much information as you possibly could in the time that we've had, and we hope, and we will have you back again to discuss how people can get really involved with your organization. So I'd like to thank each of you, Ms. Seeley, Ms. Harris, and Dr. Washington, for joining us today's edition of the Wellness Watch, sponsored by the African American Wellness Project. I'd like to thank Mr. Dean, who keeps us all together, because, knowing the chaotic way in which I do things. But most of all, I'd like to thank those people who took the time to stay with us and join us on today's edition of the Wellness Watch. Remember that health is your biggest asset. We'll talk again next week.
Thank you.
Thank you.